Hey gang, Dr. Jeff here, Legacy Chiropractic in Shipshewana, your Northeast Indiana chiropractor and health coach, coming to Fort Wayne soon. Could be coming to a town near you even sooner. Today I want to talk about low back pain, because low back pain affects many people, and I've helped lots of people with it. And I want to kind of describe a certain type of spinal condition that you might have with this type of low back pain. It's a low back pain that involves a deep ache in your low back where your hip meets your low back. It can also cause pain down your leg to act like a sciatic type pain to the knee or down to the foot. And it's a dull pain in the low back where the hip meets the low back. And a telltale sign is when you go from sitting to standing, you have this back pain. And that back pain would be called a problem with your sacroiliac joint. Let's take a look. So here we go. Mr. Spine having a seat right there. And he wants to go from sitting to getting up and standing. And what he's originally going to do, or he's first going to do, is he's going to lean forward. And as he leans forward, his hip's going to start shifting, and then he wants to get up. And as he gets up, his hips tilt. So let's turn it around. So this is called the sacroiliac joint right here. It's the sacroiliac. Sacrum is here, ilium is here. Your hip bone meets your spine right there. And there's a big joint right there called the sacroiliac joint. And a lot of nerves come out here, and there's a lot of thick ligaments there. So the ligament, thick, massive duct tape, keeps this bone connected to that bone. So when you go from sitting to standing and you lean forward, you initially separate that joint right there. So you separate the joint right in here, right where my thumb is at, and you pull on those ligaments in there. Now, if the ligaments are super strong, no problem. But if the ligaments are weak, they're going to stretch and you're going to irritate and cause inflammation right in this joint right here. And you're going to have pain through here. You're going to have pain in your rear end, even down the leg. So a telltale sign is going from sitting to standing, because this joint is going to move and separate. And if the ligaments are weak right in this area, right in there, you're going to have what's called sacroiliitis or sacroiliac pain. When you're standing up, it could hurt as well. But a telltale sign of sacroiliac problems are when you go from sitting to standing. And what we do here in the office is we put the hip in alignment, and then we put you in a belt to almost keep this thing glued together so that you can move just enough, and the belt will allow those ligaments to heal inside. Gang, Dr. Jeff here from Legacy Chiropractic. I've helped lots of patients with sacroiliac problems. We make the adjustment, we ask it to heal, and the body heals itself. If you've got a problem going from sitting to standing, you could have a sacroiliac problem. You can use ice, you can use heat. If it continues, you might want to see your local chiropractor. Thanks and have a great day.